Hello everyone and welcome to MedSci Mentor. In this video we'll be covering the differences between medical school and undergraduate courses and going into how you can effectively study for these medical classes, how to use the quizzes to your advantage, and how to make it through medical school so that you can become a great physician. This video can be used for anyone that's aspiring to be a medical student, so any of the undergraduates that are out there, for high schoolers as well, and this is also particularly useful for anyone that is just about to start medical school. As a brief introduction, I am a current MD PhD student in America. I've done the first 2 years of medical school. I am in my current PhD phase, and I will go back into the medical school and re-enter afterwards through the last 2 years of hospital training. I am also in my PhD phase working with the medical school with students directly in one-on-one sessions to both help them through harder material, what they're finding difficult, as well as holding large-scale reviews each week for the medical students. As such, I have extensive experience with the transition from undergrad to medical school, and especially throughout medical school as students pick up more knowledge and get more familiar with the physiology. I want to share my tips and tricks of how the medical school is structured, how you can effectively study, that way you can set yourself up for success. As we get started, just remember that these are, in my opinion, tips and strategies. They don't work for everyone. Everyone has their own way of learning, but just do keep these in mind and hopefully they're going to be helpful. All right, so for the first one, just remember that when you go to medical school, it's a much broader field and it has a lot of fine details in it. And this is comparing it to an individual course in undergrad. So you have to be realizing that this is going to be extremely large amount of material. There's going to be both fine detail and large perspectives. And why is this very, very important to note is you are not going to be able to cover all of the material in a single pass. Okay, not even in a single short sequence block. And so in medical school, you're going to be going through different organ blocks, you'll be going through different sections of the material because you have to cover it all in a large 1 to 2 year program. So you're not going to be able to get everything in one pass, even for a particular disease. So if you're learning about diabetes, you're going to learn about diabetes in both the endocrine lectures as well as lectures in terms of infectious disease that might be associated with that. So there's a variety of different ways that you're going to learn about each topic. Additionally, you can learn about them in the biological processes in terms of the cellular structures, in terms of the hormones that are actually activating at the cells. You can learn about in the GI sequence. So there's a variety of different aspects to individual diseases as well as individual organs. So you're not going to be able to learn everything in one pass. And if you try to, it's going to drive you crazy. You have to make sure that you're spending an adequate amount of time learning the material, but realizing that you're not going to be able to learn it all at once. Just to note in terms of structure, most medical schools, and again, this is dependent upon what medical school you're going to, but many medical schools separate out their courses into different disciplines. So you'll have the physiology, you'll have histology, you'll have anatomy, you'll have pharmacology. Some medical schools do it where they do the first year as normal systems, so normal organ blocks, how the liver functions, how the pancreas functions, and then the second year is going back through those additional organ blocks. So again, go back through the heart, go back through the lung, but this time adding in pathophysiology, meaning actually adding in disease states. So be prepared to go up through these topics multiple times because you cannot get through them in one pass. Other schools do go through them basically where you go through both the normal and disease in the same sequence and then extend their time. Additionally, be prepared to have new subjects brought up even if you haven't seen them yet. So if you're in a lecture about how cellular functions work in terms of like DNA replication, they're going to bring up DNA replication diseases even though you haven't mentioned them yet. And their point isn't for you to learn every detail about the disease, it's just to show why it's important that you're learning this. So be cognizant of the fact that you're going to learn new things as you go through them. This kind of gets you to point 3, which is you need to build a broad perspective. So while the fine details are extremely important, one way to learn through this is to have a broad perspective first. Fit in where you're going to have the organs. Like how does the liver tap into the pancreas? What does the liver do? What does the pancreas do? You really need to build a broad perspective so you can plug in the fine details as you go throughout the sequence. So think of the first pass as a broad perspective, and then you fill in the fine details as you go. Additionally, which is the fourth point here, repetition is going to be extremely important. You are going to need to repeat everything that you hear in medical school. And not only just in terms of writing things down, you're going to get the repetition in medical school. So you might hear the same disease in terms of your anatomy lectures, in terms of your physiology, in terms of your histology. Don't think of this as a waste of time. A lot of people can get very frustrated saying, well, why am I learning this again? The important part is that you're not trying to learn it again. You're trying to learn it the first time, because you need multiple passes to get that to set into your mind and make the connections that you need to draw upon. So be very, very careful with trying to explain away repetition. You need that repetition. So one time, the first pass is going to be your lectures. The second time might be a different lecture that references the same material. The third pass, you could be taking notes during lecture. The fourth pass, it could be actually your next pathophysiology sequence. The fifth pass might be actually with working with patients. So do realize that repetition is extremely important, and don't shy away from that. All right, so now we're going into how to study for medical school. So now how to study for medical school is, the first thing is don't trick yourself. And now this is a little controversial, but the big point here is that if you're honest with yourself, you're not going to surprise yourself. And so what that means is that if you believe you're really paying attention and you go to lecture and you're sitting there, but you're on the internet doing other sites rather than actually paying attention to lecture, but you're convincing yourself that you are paying attention because you're going to lecture, you're not being honest with yourself. You need to really, really be honest with yourself that you are going to lecture and be at lecture and focus on lectures, and don't start goofing off during the lectures. And I'm not making any I'm not trying to bring anyone down here. Every single person has done this before, especially in college, especially in medical school as well, where you're just not engaged, or maybe something doesn't seem that important, and so you kind of check out. If you are not being honest with yourself, you're not going to be engaging, you're not going to be paying attention. So I really do recommend that you try to make a schedule for yourself, try to make sure that you are paying attention. Really don't let yourself get away with getting behind the lectures. And so one thing is that medical schools, sometimes a lot of them nowadays are streamable, meaning you could stay at home and watch them rather than go into the lectures. Now, if you are getting up in the morning and you are sitting down and watching the lectures so you can pause them and take notes, then that is great. But if you're not doing that and instead you're waking up later and then you're streaming the videos at 2x speed, but you're telling yourself that this is much more efficient, then you're just kind of lying to yourself, right? You're not putting the effort in, and so it's not surprising if you have problems down the road. So set yourself up for success. Make a schedule to go to those lectures. If you can, go in person, so that way you can actually have a schedule going along with it. Now, of course, sometimes people can't get there. Some people can't make that schedule work, which is completely understandable. Everyone has an individual life to live, but do try to keep yourself honest. If you're having some problems with material, spend a little more time on it. It's okay. Just really resist the urge, which is a problem that a lot of medical students will run into one or two times, where they put all of the lectures off till Friday. So if your medical school has quizzes on the weekend, don't put all the lectures off till Friday. Now, sometimes you can't avoid that, but in general, it's a really bad scenario because, as we talked about before, repetition is very important. And a lot of times they're going to have multiple days where they repeat the same thing, but if you watch all in one day, you're not going to get that out of it. So I'd really recommend that. If you do watch a lecture where you know most of the material, then start quizzing yourself on it. So predict what the next slide is going to be, predict what the next point is going to be, predict what the next drug is they're going to mention. So really kind of use it as an active learning system, which is going to really help you kind of focus in on what you know, what you don't know. You can really start trying to figure out what you need to focus on in the future. So again, don't trick yourself. Try not to passively study. Really try to engage with it, and then give yourself time off afterwards. But do engage with the lectures, and really, really try to test yourself as you're going through these lectures. All right, this next point is very, very important, okay? What you have to realize now is that you are beyond proving your intelligence. If you're an undergrad and you're upwards of senior and junior and you're going to apply for medical school, you've proven that you're intelligent. If you're in medical school, you've proven that you're intelligent. Intelligence isn't what you're trying to do anymore. You've proved that you're capable. You've proved that you're able to learn, understand, and apply yourself. Now, the real thing that you need to do in medical school is to build a foundation of medical knowledge and test continuously where your weak points are. The purpose of medical school is to teach you how to be a physician and have the medical knowledge available to help your patients. The purpose of step 1, which is a future test, in case you haven't heard of it, is to judge your ability to have that knowledge accessible. It's not to punish you. It's not to prove you're intelligent. So when you're going through medical school, you need to be able to find your weak points and start developing those weak points into strengths. So you're no longer trying to prove your intelligence. You're intelligent. You don't need to compare yourself to other students. And I understand that there are competitive residencies you're trying to apply for. I understand that. And so it's not to say that that's not true. It definitely is. But instead of focusing on the direct outcome, focus on the process. The process is that you want to become an amazing medical student and therefore amazing physician. So focus on being amazing a medical student, and that's going to develop you into someone that can compete at a very, very high level. So really try to engage with your lecturers, realize what you need to motivate yourself, and seek difficult concepts out that you don't understand, so that way you can actually conquer them and put them into a stronger foundation. So this is no longer about when you get something wrong that maybe you're not smart enough to get it right. You are smart enough to get it right. When you get something wrong, it's not that you failed. It's that you have a weak area that you need to focus on, so then focus on it and then fix it. But when you have a bad score on a quiz, they're not trying to punish you. They're giving you the quiz so that you can find that knowledge that you need to add to your strength. There's so much material that you need help identifying those. So really look at the quizzes as things that are trying to help you identify problems in your knowledge that you can fix. Again, not in your intelligence, in your current knowledge. So really do try to be honest with yourself. Try to not focus entirely on judging yourself to other people. Judge yourself to who you are and figure out what the weak points are. And especially if you miss a question, make sure that you're judging all the material that are around what you missed, because in general, there's going to be a knowledge gap that widens out from what you're missing. And so then the third point to help you study is to develop a schedule. So if you go to lectures and your lectures are already scheduled for you, they're already in a predetermined order, so that's a very, very large load off your mind, which is why I recommend going to lectures, or at least watching them in the streamable order and timeline that they're giving them to you. If you don't have that, then you're going to have to develop those lecture schedules yourself. Now, beyond that, you need to develop a schedule for actually putting in your study time. So have time in your day where you're going to review your notes. Have time in your day where you're going to review the past week's material. Have time in your day later on in medical school where you're reviewing the previous sequences. And it doesn't have to be a lot of time. It doesn't have to be continuous. But for instance, if you're going to review previous sequences, maybe one day a week, or maybe like a few hours a week. That's all you really need. But just have that scheduled in there. And on top of that, also schedule in time for yourself. So know when you can kind of sit down and relax. You need to be able to recover your mind. But again, be honest with yourself. Don't schedule too much time for yourself and not have enough time, especially in difficult sequences where you really need to start paying attention. And with that, then I would recommend getting some type of calendar application. So that could be Google Calendar, it could be a task manager, it could be anything that you normally use, but something that's easy to access and something that's easy to see what you have for that day. All right, so now for the last point, I would recommend that you don't focus on step one review at the beginning. And so again, this is controversial. This is something that everyone has their own opinions on. I would recommend that you don't, because basically medical school is your studying for step one. And if in case anyone doesn't know what this is, step one is basically a test that you take after the second year of medical school, and some programs have it later on, where you're basically testing your foundational knowledge, meaning your book knowledge, so what you learn in lectures. The step two is what you basically are studying in terms of your clerkships or in the hospital. So medical school is split into basically didactic, lecture-based in the first 2 years in general. And then the last 2 years are like, if you're thinking about like apprenticeship. So you go into the hospital, you shadow physicians, you actually work as physicians, but not, obviously you're not making the end decisions, but basically you're trying to be an apprentice to them and you're trying to learn the ways to be a physician. So then step one, you don't need to be preparing for it immediately. You want to be focusing on your material that's in your courses, and then that will prepare you for step one. And then later on, you're going to get time to review step one. However, what you can do is there's a lot of material out there for basically studying for step one in terms of like question banks or other books. You can use them for sequences that you've already completed. So for instance, if you've completed your sequence on heart, then you can basically turn that and then use the step one review systems to basically review the cardiovascular system as you continue down into maybe the lungs or the renal system. All right, we're going to repeat what we said earlier, which is basically what the structure of the medical school is very briefly, and just terms of how the curriculum is normally shaped in medical school. So as we mentioned before, the first 2 years are normally lecture-based. Different medical schools will differ, so when you're applying for medical school, look at how your system is scheduled. Do you do 2 years of book learning? Is the first year normal, second year diseased states in terms of like diseases and pharmacology, and then third and fourth year basically in the hospital rotating with doctors and different wards? Or is your structure basically first year and a half is going to be normal and disease together, and then you go into an earlier clerkship phase in the hospital? So some programs are moving that way. So definitely take a look at that and see what you want to do. In terms of the didactic lessons or the first 2 years, as we mentioned before, there are longitudinal disciplines for the most part, which are going to be histology, anatomy, pharmacology, and clinical skills. So a lot of programs in medical schools will have specific courses that you take longitudinally. So basically you'll have every week maybe one lecture of histology. And that histology lecture in that week will feature the histology for the organ systems or diseases that you're looking at. So if you are in a sequence, meaning like a set of weeks that's focused on something. So a sequence for the renal system, maybe it could be 2 or 3 weeks long. You're focusing on the renal system, meaning the kidneys and the bladder and everything like that, in terms of now you're going to look at those individual organs that are associated with the renal system, and then you're going to actually then focus in on the histology during that day on the renal system. Anatomy, you might be going through the anatomy of the renal system. And then pharmacology, maybe drugs that are affecting diseases with the renal system. And then clinical skills, maybe you're associating with symptoms that might have come up with someone that had renal conditions. And then additionally, you'll have your actual lectures throughout the week that are associated with the renal system. So going through the kidney, going through how the kidney filters. So then those are going to be your organ blocks that would be basically set up in time. So you're going to go through like cardiovascular for 3 weeks, then respiratory, then renal, then gastrointestinal. And then along those routes, in each of them you have histology, anatomy, pharmacology to go along with those organ blocks. And then additionally, those clinical skills, normally you're going to have them longitudinally, teaching you how to take histories, teaching you how to do physicals on patients, teaching you how to write that up, teaching you the skills that you need to make differential diagnoses. So those are the type of things that you should be seeing. Additional organ blocks, again, would be like endocrine, reproduction, neuroscience, in terms of like the nervous system, musculoskeletal, immunology, dermatology, hematology, also like psychiatry. And so just and also infectious disease, for sure. Infectious disease and also immunology. So just to remember that infectious disease and immunology are, again, going to be ones that are going to be found in a lot of organ blocks. So depending on how your system is structured, you might actually get immunology much later as a block, but you're going to be learning about immunology and infectious disease earlier because a lot of organs are affected by certain infectious diseases. So again, this is one of those things where you're going to get things brought up before you have canonically seen them, before you actually seen them in context of the organ blocks, but you just need to go with it as well. An additional longitudinal sequence may be embryology. So embryology is basically how you grow from a fertilized egg all the way up to a full-fledged human. And that embryology can be either a single block and then utilize in that block, basically showing you how it works, or medical schools could structure embryology to basically show you how you develop the different organs as you go through those organs. So just keep in mind that different schools will have different structure, but you will go through, for the most part, the same content. Now we're just going to basically draw out a sample structure here. So this will be a sample week, just to kind of give you a feel for it. So Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, and Sunday. Just remember that you have to see when your medical school does quizzing. So some medical schools quiz on the weekend after every single week to keep you on track in terms of your knowledge. Other ones might quiz at the end of 2 weeks. So some medical schools do a quiz at the end of every week and then a final at the end of every sequence. So meaning if your cardiovascular sequence was 3 weeks long, maybe you do a quiz 1, quiz 2, and then a final at the third week. So do see how they structure those. Different ones will have different types of questions, but for the most part, you're probably going to have multiple choice questions. You're going to have multiple choice questions that are associating with the organ blocks that you were in, and you're going to have them be certain number of lengths based on the lectures that you've gone through. Do see if they allow you to take them on Friday, Saturday, and Sunday at your own time. Some of them will basically schedule time for you to take the quiz, so that is something to look into. And then in terms of the actual structures of the week, so if you're in the cardiovascular sequence, you might have lectures that are associated with the cardiovascular sequence, meaning how the heart pumps, what diseases could the heart have, how does the heart contract its muscles, what are the nervous system inputs onto the heart. Those could be in the morning, so maybe 8 to 9, 9 to 10, 10 to 11, 11 to 12, or maybe starting at 9, depending on what medical schools you're going to. And then in the afternoon, those could be the longitudinal sequences. So it could be anatomy on one day, and then histology on another day. And then another day might be clinical skills and small groups discussing ethical issues. Another one could be patient presentations. You might be being shown a patient or have the opportunity to talk to a patient with their experiences about the disease, which is extremely useful because you're seeing what they actually are experiencing and actually be able to talk with them, especially when you're not able to get into the clerkships. In terms of the structure, this is what a lot of medical schools will do. But again, remember that this is not like undergrad where everything's scheduled very, very rigidly beforehand. The weeks in general will switch. So maybe sometimes you have defined times where you have anatomy and histology, but in general, you're going to have a certain number of lectures each week that will change. So do take a look at your sequences when you're going into them, see how many hours of lecture they have, see when they place them, know when they have quizzes. Just keep that in mind because it is important context, and just remember that you're going to have a schedule like a Google Calendar or something like an Apple Calendar, because you're not going to have the same quizzes and tests, and you're not going to have the same classes every single week. So things will change, especially if there is a specifically new content that's coming up in your new sequence. Maybe there's a new thing that you need to go to, or there's reviews. So do keep in track that the fact that it changes by week. So you need to be on top of when your lectures will be, and then when you need to be able to scheduling your study time, and just make sure that you do know when things are happening within your particular schedule. Comment down below if you have any questions on scheduling. We'll put together a video in the near future for how to schedule specifically and go through different medical school structures. All right, now we're going to move on to test taking for medical school. So this will be the quizzes that you take in medical school and the finals that you have. Definitely check with your schools which quiz structure they're using. So some of them will use quizzes at the end of every week. Some of them will do it at the end of every 2 weeks. Some of them will have finals at the end of every sequence. Different schools will also have quizzes in terms of their longitudinal blocks. They will also use standardized tests to basically see how you are doing along the way. So they could have a test over cardiovascular, respiratory, and renal, and then have another one later on, so larger test blocks. So do check with them to see what their structure is in terms of getting you prepared for your step one. Also look at the structure of these tests. So they could be short answers, they could be multiple choice, which is probably what they're going to be for the most part. Multiple choice is very similar to what you're going to be taking in terms of your step one and step two, very similar to the MCAT in structure, but they'll be more medical related in terms of pharmacology, treatment plans, mechanisms of diseases, organ systems, and that aspect of the medical curriculum. So definitely check and see how they structure their testing. Additionally, check to see how they grade. So the grades could differ, again, as we said. So the grades could be pass-fail the first 2 years and then switching into grades in the clerkship phase, or you might have actual grades in the first 2 years. So definitely do check with that. When you're taking these tests, it's very important to note why you're taking them. So if you're going into these tests and you're thinking that they're useless and that they're a waste of time because they're just trying to get you to take these tests to rank you against your other medical students, while there probably is some truth to that, you'll not be getting the best benefit out of these quizzes because you really should be going to them using them as a source of knowledge in terms of what you're missing within your foundations. So if you really think about what these quizzes are, they are developed by your faculty for your particular actual content. So these are your faculty making them on the content that you've just learned. So they're personalized to you, and then they're there to basically allow you to judge which areas you're weak in. So if you miss a question on hormones, then that indicates that you're going to be weaker in that area, so you should try to shore up what you're missing and really fix your knowledge gaps in that area. Additionally, when you take questions and you're sure that you've had experience with standardized testing in terms of MCAT and SAT and ACT, we'll also put together a video on testing strategies like that. In general, when you're thinking about a standardized question in terms of a multiple choice format, there are two main strategies going into it. There's the offensive and the defensive, and both of them have their uses. But in terms of medical school and testing your knowledge, the offensive strategy is going to be more useful for you. The defensive mindset for these questions is, if you ever felt this, when you go into a question and you're very, very worried about getting it wrong, you're not looking necessarily for like an adventure to go through the question and find the best answer, but instead you're just trying to mitigate your damage. So you're looking at the answer choices and you're trying to just pick the one that you think could be the least damaging for you. So if there is between two different options and one you do think is more right in terms of being more well fitted for the question, but there might be something a little bit wrong with it, but you're not exactly sure, but you're going to select the other one that you feel more comfortable with in terms of basically just being a little more defensive. You're erring on the side of basically a safer route. The offensive one is basically you're focusing on trying to actually identify what your knowledge gaps are, and you're trying to really go for the best answer based on all the knowledge you have. And it's really about the process. So the outcome for both of them is ideally the same, trying to get the right answer. But for the offensive mindset, you're basically trying to have an adventure, trying to find out the best answer. You're trying to work through them and really engaging with the question, engaging with each of the answers, and trying to find the best one based on all the knowledge you have and based on all the clues in the question. Whereas defense is really just trying to mitigate the damage. Now, in terms of if you miss a question on a quiz or test, this is the best time to go and correct your mistake. So if you have a question that's wrong and you know why you missed it, widen out from that area to see where your knowledge gaps are. So for instance, if you miss a question on hormones, it's very likely that you are also missing other hormone-related topics around that one hormone you missed. So if you missed a problem on thyroid hormone, you probably have also problems with parathyroid hormones or the thyroid structure or parathyroid structure or calcium regulation. Those are very different aspects in terms of like the parathyroid hormone. Or maybe you're having problems with metabolism and generalized metabolism in terms of like T3, T4. So we'll get into all those. But the point is that once you have a certain thing that's missing, you're probably missing the area around that. So do widen out from there. All right, so this last topic for this video is going to be, why do you want to go to medical school? And so we've mentioned this a little bit, but this is very important, is that the way you think about what you're doing and why you're doing it has a drastic impact on how you enjoy it and how well you're handling the stress that's associated with that journey. So you need to know why you're going to medical school. If you're going to medical school just to prove that you're the best, it's going to be very, very difficult. It's going to be hard. You're going to be really dragging in terms of if you get a question wrong. And maybe you're a kind of person that really feeds off that competition. But if you really ask the question why you're trying to go to medical school, if it's to be a great physician, if it's to help patients, if it's to really advance the field and save people in the future, then good grades are just a process to get there. They're not the outcome, right? And so you want to use your questions and your quizzes to really gauge your foundation so you can build it up, and then the process is the thing that really matters. So you really need to have a correct goal in mind so that way the things along the way aren't going to destroy you or really, really drag you down if you have a question getting wrong. Because if you have a question getting wrong and your goal is the grade, then there's no way necessary to remediate that at that time. However, if your goal is to be a great physician and to help patients and to build a strong foundation, then missing a question is actually great, because then when you miss that question, you can go in, repair that area that was missing, because everyone has knowledge gaps. But now you're able to repair that one area, and so you will be stronger in the future. So you weren't delayed at all. Missing a question on a quiz or a test didn't delay you. It actually helped you. And that's the difference between having the correct outcome. And again, correct is in my own opinion. Everyone has different things that drive them. So whatever works for you. But definitely do spend a little bit of time asking yourself why you're going to medical school. Why is this important? And if you really do enjoy the process, the struggle, trying to incorporate all that new knowledge, that like competition aspect of basically trying to make yourself better, competing against yourself, then if you enjoy that learning process, this is going to be a wonderful experience. Additionally, your faculty and your professors and your classmates are a great resource for you to work with. So talk to your faculty. They love talking to people. Like email them, go to their office hours. That's what I'm saying. Go to lectures, because people engage more when the students are engaging with them. So if you go to lecture and actually talk with them afterwards, they're going to bring more enthusiasm to your lectures. And it will not only help you, but it'll help the next class after you. So really do engage with your professors and your faculty. And then build study groups with your classmates. Ask people questions. Ask each other questions. Really build off of each other and try to challenge each other, but not in a deconstructive way, in a constructive way. You're trying to compete with each other to basically all become better physicians, rather than just compete and try to get onto the top of the hierarchy. And then the fourth thing, really, again, enjoy the journey. Realize that you can't control everything outside of yourself. You can only control what you do and how you react to the outcomes. Sometimes bad things will happen. Sometimes you won't do well in a quiz. Sometimes things will go wrong. Sometimes it'll be very, very difficult in terms of an individual week or even a month. But the only thing you can control is yourself and your responses. So enjoy the process. And I'm just going to leave you with this little bit of a quote from the Stoic philosophy, which is, "The impediment to action advances action. What stands in the way becomes the way." So this quote from Marcus Aurelius is a very meaningful one, because basically what it says is that if you have a problem, if you identify that you are lacking in a certain knowledge field in terms of maybe like reproduction or cardiovascular, that is the obstacle and that becomes the way, meaning that you're going to now focus on the cardiovascular system and correct the knowledge gaps that you have there, and that becomes the way for the next few days or weeks when you're studying it. The medical school curriculum is not designed to be an obstacle that you cannot overcome. It is supposed to show you the path ahead of you. It's supposed to be the journey that you make to get all that knowledge, to get that foundation built. And if you're an undergrad right now, it's the same thing with the MCAT. It's the same thing with your classes, so do keep your head up. Thank you for watching this video. I hope this was helpful. In the future, I'm going to be making content for both undergrads in terms of MCAT preparation, as well as preparing for medical school. I'm also going to be making videos for medical students. I'm going to basically be summarizing the weekly reviews that I've been doing, and this is going to ideally help you get through your content and just experience it in a different way. Do look out for those. If you can do me a huge favor and subscribe and hit the notification bell, that way you get notified of new videos in the future. Comment down below. I'm going to check all of them. Tell me what content that would be useful for you or ways that I can adjust these videos. I look forward to talking you through down below. I hope you have a great rest of the day.